Hello everyone, welcome to the Weight Loss Surgery Institute of the Central Coast exercise class. We don't have any music for today, so go ahead and throw on your favorite song. So we're going to get started and we're just going to curl your legs back. The purpose of our warm-up is to get blood flowing, circulating through our body to help prevent any injury. So we're just trying to warm up, and the warm-up, you'll know when the warm-up has ended because you should be at a light sweat and your rate of breathing should be a little bit harder than it is when you are at rest. And when you're warming up, you want to start off slow and slowly build up your speed and resistance levels. For each of these warm-up activities, we'll be going about 30 seconds up to a minute. Whenever you do an exercise bout, you should always have a few key components. The warm-up, which we're doing now, your exercise bout, which will be introducing some resistance exercises, and a cool down at the end. Okay, we're going to march up. In general, it's best to do all these exercises 2 to 4 sets of 10 to 15 repetitions. So if you have any orthopedic or medical conditions that don't let you stand, we can do the same thing seated. Keep going there. You can do the seated marching. And we'll go ahead and stand back up. And we're going to reach across. And you can do this motion seated as well. If you need to be in a chair, that is okay. Everything we do, we're going to try to keep our core nice and tight. If you think about pulling your belly button back towards your backbone, obviously, you're not going to get it there, but just engaging those muscles. And we're going to bring it up to about shoulder height. And everything we are doing, we want it to be in a pain-free range of motion. The days of no pain, no gain are gone. And just remember also that everybody is at their own level. Don't try to compete with anybody else except for yourself. Every day, do what you can do and try to get a little bit better each day. And then we're going to bring it up overhead, whatever you can get in your range of motion. And bring it back down to shoulder height. Okay, and if you can, we're going to try to reach opposite heel to hand. And our core is still engaged, tight, protecting our low back. And we're going to go opposite knee and hand up, whatever you can get in your range of motion. Okay, we're going to do some lateral kind of walking. We're just taking a step to, we're going to go this way, and then cross in front, side, crossing back, out, going back this way. Cross in front, side, crossing back, cross in front, side, back, cross in front, and back, cross in front, back, front, back, front, front, back. Okay, we're going to come back to center, and we're actually going to have a seat, and we're going to grab onto our resistance band. We're going to go through a few resistance exercises. We're going to work our back muscles first. So we're going to wrap the band around our feet, sitting up nice and tall, engaging our core. That's protecting our low back. We're going to have our elbows straight out in front, squeezing back, control forward. As we squeeze back, we're breathing out. As we control forward, we're breathing in. And we're squeezing those muscles in between our shoulder blades. And it's a nice, smooth, controlled motion. You want to be in control of your resistance, whether it's a resistance band, your own body weight, dumbbells, medicine balls, whatever you're using for resistance, you need to be in control of that to reduce your risk of injury. And take a deep breath. I'm going to take that band, I'm going to wrap it right around our chair. We're going to be doing a chest press. So we're breathing out as we press forward, breathe in as we control back. And if you don't need to use the back of the chair for assistance, then I encourage you not to use the back, because that's going to force you to use your core and those muscles in your stomach and your low back. But of course, if you have a back issue and you need to use the back of the chair, do it. Okay, we're going to take that band and bring it back around. And we're going to work our shoulders here. And I'm going to make you think just a little bit. So we're going to bring our right hand straight in front and our left hand out to the side at the same time. So we're going to breathe out as we raise up, breathe in as we control down, and we only need to go up about shoulder height. We don't need to go overhead. So when we're doing these exercises, I recommend that you go between 10 to 15 repetitions. So each time we're raising the resistance up, that's one repetition. And take a deep breath and switch directions. Left arm forward, right arm to the side. Keeping the core nice and tight. And do 2 more. Okay, we're going to take this band and we're going to wrap it around our legs. And you're just going to kind of hold that there. We're going to work our hips, the outsides of our hips. We're going to squeeze out, pause, and control in. These muscles are important to work because they help control our gait and help with balance. So as you're losing weight, your center of balance is going to be moving and being disrupted from what you're normally used to. So working these muscles is going to be important for you to help maintain your balance as you lose weight. And we're going to take that band and we're going to wrap it through one foot on the instep of your foot. We don't want it to be up too high on your toes because it'll roll off and come snapping back at you. So we're going to press out, control back. So we're going to breathe out as we press out, breathe in as we control in. So in general, you want to breathe out during the exertion part of the movement. We'll get 2 more here. And go ahead and switch to the other leg. Core is still pulled in tight. Breathe out as we press out. Control back. Okay, we're going to set the bands down. And go ahead and stand up. We're just going to curl back again. Make sure our heart rate stays up. And if you need water at any point, go ahead and sip on water. Got to make sure that we stay hydrated. A lot of little sips of water throughout the day. So during these exercises here, we're going to pick our pace up just a little bit. And we'll march it up. The further out you get from surgery, the more you're going to be able to do. Your endurance will pick up and your strength will pick up. So you're going to learn how to adjust your workout to fit your energy level and your strength. Because we don't want to stay stagnant and stay on the same level the whole time. Okay, we're gonna reach across again. And our core is still tight. So we should be starting to break a sweat a little bit. And we'll bring it up to shoulder height. And bring it up overhead. When you first start an exercise program, listen to your body. If you need to sit and take a breather, do it. You don't have to try to push through on the first day or when you're first starting that exercise routine. And we'll bring it back down to shoulder height. And we're going to reach opposite hand and heel again. And we're going to go opposite knee and hand up again. So doing things in opposition like we're doing with our hands and knees makes you think a little bit. It works a little bit on our neuromuscular coordination. Okay, we're going to do some squats. We're going to start off standing in front of our chair, and we're going to have that chair there for a safety stop. If you have never done squats, it's going to be a modified, shortened squat. So when we're doing our squat, our core is tight, our feet are about shoulder width apart, both feet are pointing straight ahead. And as we are coming into that seated position, we're breathing in and breathing out on the way up. So I'm going to only do a half squat initially to show a modification. So we would come down. We don't want the knees to go past the toes, and our back is flat. And then coming up. Come down and up. So now we're going to go all the way down, and as soon as you feel that chair, we're coming right back up. Okay, so we're going to work our back again, and we're going to work our triceps at the same time. So we're going to do what's called a combination exercise. We're doing 2 in 1. So grab your medium weight, and we're going to be hinged forward at our hips, letting the weight hang straight down. Our knees are slightly bent, and we're squeezing up into a row position. We're squeezing up, and then we're kicking those dumbbells back. Then bringing it back down and down. Up and back, down and down. So we're working our back muscles and our tricep, the back of the arm. We're going to do 2 more. Okay, and we're going to do our shoulders. So we're going to do that same motion that we did before. Our right hand's coming forward, left is coming out to the side. That causes us to think, and it also puts a little bit of an extra healthy strain on our core. Breathing out on the way up, breathing on the way down. And take a deep breath and switch to the other side. Okay. We're going to set these down. We're going to grab onto your heavier dumbbells. We're going to do some bicep curls. Pull those shoulders back, palms facing forward, and breathe out as we curl up. Breathe in as we come down, nice and slow. So when we're doing these, we want to come down slower than when we go up. Nice long deep breath in as we control the weight down. Okay, now we're going to do overhead press. So adjust your weights to either the light or middle. And then when we're doing our overhead press, our knees are slightly bent, our core is nice and tight. We're bringing the elbows up to parallel to the ground, and that's as low as we want them. We don't want to bring them way down here. We're going to bring, this is our starting position. Breathe out on the way up. Breathe in on the way down and stop right there. You want your elbows to be parallel to the ground. It's going to be, take some risk of impinging your shoulder. It's healthier for your shoulder not to come all the way down. Okay, so we're going to do some push-ups. So there are some modifications, okay? We can do a push-up on the wall with our hands roughly shoulder height, our knees slightly bent, breathing in as we come down, breathing out on the way up. So that would be level 1. Level 2 would be using a countertop or something a little bit lower. I'm going to use this bench right here. Again, the same breathing in on the way down, out on the way up. And you want to have your back nice and flat. You don't want your back to sag down, and you don't want your butt to stick up high. Just like a 2x4 plank. And you don't need to bring your chest all the way down to the ground. You should have at least a fist width in between your chest and the ground, or whatever the surface is. And then the next level would be to do push-ups from the knees. And again, your hands are roughly shoulder width apart and at shoulder level. Breathing in on the way down, out on the way up. And the next level would be to be on your toes. Breathing in on the way down, out on the way up. Okay, so now we're going to get a set of those in. So wherever you are at in that continuum of push-ups, that's where you want to be. And we're going to shoot for 10. If you can't get 10, get what you can. If you can get 2, get 2. Breathing in on the way down, out on the way up. Okay, great job. And we're going to do some side lunges or squats coming to the side. The knee does not want to go past the toe. This leg, the toe wants to stay relatively straight ahead. So we're going to feel a little stretch on the inside of this leg, and we're going to be working this leg. And you go down whatever you feel comfortable with. Switch to the other side. Okay, we're going to work our calf muscles a little bit. Use that chair for balance if you need it. We're just going to come up onto our toes, down, toes up, heels up, toes up. So when we're picking those toes up, that's working the front of our shins. And those are the muscles that work every time we walk, lifting those toes up. Those are important muscles because if those get weak when we're walking, we start shuffling our feet. And we don't want to trip and fall. Okay, and we're just going to curl our legs back again, making sure that our heart rate is staying elevated. So when we are working out, there's a zone that we want our heart rate to be in. And typically that's going to be between 60 to 80 to 85% of our age predicted maximum. And a simplified way to figure out what that is, you take 220 minus your age, and whatever that number comes out to, you multiply that by 0.6. That gives you your lower end number. And 0.8 will give you your high end number. And once you've been exercising for a while, I would say at least 6 months, then go ahead and you can up that up to 0.85. And we're going to march it up again. And the American College of Sports Medicine recommendation is for all of us to be getting at least 5 days a week of aerobic types of exercise, like what we're doing right now. Walking is great aerobic. Aqua aerobics, riding a bike, hiking, dancing, Zumba, whatever you like to do, that you are continuously moving those large muscle groups between 30 to 60 minutes a day, 5 days a week. And we're going to reach across again. And the resistance exercises that we are doing, we want to do at least 2 days a week with at least 1 day of rest. And you can do as many as 3 days a week. Just making sure you have at least 1 day in between each exercise bout for your resistance exercises. And bring it up to shoulder height. And bring it up overhead. And back down to shoulder height. So the key to exercise is consistency. When you first start out, you're going to get a little muscle soreness, you're going to get a little tired, but stick with it. It will pay off in the end. And opposite heel and hand again. And we're going to go opposite knee and hand up again. And we're going to walk to the side again, out to the side, front, side. Over, front, side, back, front. Front, side, back, side. Some people might know this as a grapevine. This is about the extent of my dancing capabilities. So this is good for the hips, stretching out those muscles as we take nice long steps. And then coming back to center. So now we're going to do those side lunges again. Coming to the side, up, other side. And our core is still tight. That belly button's pulled in to the side. We're going to do 2 more each direction. Okay, now we're going to do front lunge. So we're taking 1 step forward. That front knee does not go past the toe. The back knee does not touch the ground. So you're going to bend both knees. You come as low to the ground as you feel comfortable. You might only go a couple inches the first couple times that you do it, and that's okay. We want to try to have our shoulders slightly pulled back, keep our back flat, core engaged. And we'll switch. Remember that back knee does not touch the ground. Okay, let's go ahead and have a seat. We're going to do our bands again. We're going to work our back muscles. Feet out in front of us. Sitting up nice and tall. Breathe out as we squeeze back. Breathe in as we control forward. And take a deep breath and take that band and wrap it around our back or the back of the chair. Sitting up nice and tall, breathe out as we push forward. Breathe in as we control back. Make sure that core stays engaged the whole time. And if you feel your core get loose and not engaged, just pause, reset. And we're going to take that band and wrap it around one foot. Bring up your leg, press out, control back. And take a deep breath and switch to the other leg. Press out, control back. Make sure that band is in the instep of your foot. And go ahead and step onto that band. If you need to change your band, you can go ahead and change your resistance. We're going to do a bicep curl. We're going to stand up. Our feet are going to be about shoulder width apart. Shoulders pulled back. Breathe out as we curl up. Breathe in as we control down. The knees are slightly bent. Okay, so we're going to let go with one hand, and we're going to step on the band with both feet. We're going to bring the band, we're going to do a shoulder press. We're going to press up, control down. If you need to use a little bit of your legs to push up, that's okay. And take a deep breath, let go of the band, and switch sides. If you need more resistance, step further out on the band. If you need less resistance, step only on with one foot. Breathe out as we press up. Okay, we're going to set our bands down. We're going to start our cool down. We're going to, with our arms, we're just going to do some arm circles, just small circles forward. We'll go 5, 4, 3, 2, 1, backward. 5, 4, 3, 2, 1, up to shoulder height forward. 5, 4, 3, 2, 1, back. 5, 4, 3, 2, 1, up forward. 5, 4, 3, 2, 1, back. 5, 4, 3, 2, 1, back to shoulder height forward. 5, 4, 3, 2, 1, back. 5, 4, 3, 2, 1, down forward. 5, 4, 3, 2, 1, back. 5, 4, 3, 2, 1. We're going to do some stretching from the chair. These stretches you can also do from the ground, but we're going to show them from the chair today. We're going to work our hamstring, the back of the thigh. Heel on the floor, toe up to the ceiling, hinging from our hips, okay? You hinge forward until you feel a slight pull in the back of your hamstring. Should not be painful. Stretching should not be painful. Your muscles should be warm. When we're doing our stretches, we want to stretch 20 to 30 seconds with each muscle group. If you want to do more than one set, feel free. And bring it up and switch to the other side, hinging forward from the hips until you feel a nice stretch, a slight pull in the back of the hamstring. You may even feel it behind your knee or even to the top part of your calf, depending on how tight your muscles are. You have muscles that are in your calf that cross the knee joint, and you may feel it into the calf, and that would be because those muscles are too tight. So you need to stretch those muscles as well. And we'll get to those later. So we're going to get our quadricep, the muscles on top. So we're going to kind of scoot to the side of one chair, and we're going to put our foot to the side, and we're going to lean back into the chair. And we're going to control how far back we go with our upper body. We're looking for a stretch on the top of the thigh, maybe even up into the hip, okay? One of our quadricep muscles is also a hip flexor. So if that's tight, you'll feel it there as well. If you have bad knees, be careful with this stretch or skip it, okay? The farther back your foot goes, the more of a stretch you're gonna get, but also the more stress you're gonna be putting onto your knee. Taking a few deep breaths. And nice and easy, coming on up. And we'll switch to the other side. And again, stretching should not be painful. Ease yourself into it. So we're stretching as part of our cool down and to help elongate our muscles. If you're looking to increase your range of motion through stretching, it takes a long time. Don't try to get there in one day, 1 week, or even 1 month. Okay, so we're gonna lift our foot, cross our ankle over our knee, and then we're gonna pull that knee towards your opposite shoulder, okay? Nice and easy. This is gonna stretch out our glutes, okay? Sometimes people get what's called piriformis syndrome. This is a good stretch for that. Or sometimes you hear people say sciatica. This stretch will help with that, or help prevent it too. And nice and easy, switch to the other side. Nice and easy, pull that knee toward the opposite knee. Sitting up nice and tall, a couple of deep breaths. And we're going to go ahead and stand up, and we're going to stretch out our calf muscles. So we're going to use our chair as stability. We're going to put one foot back, toe pointed straight ahead, and we're going to lunge with our front foot until we feel a stretch. We're going to keep that back knee bent, the back knee straight, the front knee bent, and we're going to hold this for about 20 or 30 seconds. We want to make sure our heel of our back leg is staying onto the ground. So now what we're going to do, we're going to stay in this position, but we're going to try to bend the back knee and keeping the heel on the ground. So this is going to stretch a different muscle in our calf. Our calf is made up of several muscles. And two of our main muscles in our calf, the first one that we did was the gastrocnemius, and this is our soleus. Those are the two larger muscles in our calf. So we'll come on up and switch. Knee straight on the back leg, lunge into it. So this is stretching the gastrocnemius. And let that back knee bend slightly, keeping your heel on the ground. And then come on up. We're gonna get our shoulders another stretch. Grab behind our elbow, pull across. You can let that hand rest on your shoulder if you want. And we're just looking for a stretch in the back of the shoulder, or might even get into the top of the tricep. A couple of deep breaths. And our core is still engaged. And release there, reach across. And release there, reach up, give yourself a nice big hug, tell yourself you love yourself, you did it, great job. Do it again in a day or two.